Thank you, Madam Chair, and thank you to the panel for being here again today. I know there's been a lot of things that have happened, and we've actually been trying to, I know we did this supplemental appropriation and made the funds available, also communicating with many federal and state agencies to make sure we get information out to our constituents. So that's a lot of what we've done. Even this morning had a couple briefings, a bipartisan briefing in the Capitol Visitors Center, also on the phone with the White House and some other people. In addition to that, in Pennsylvania, our Secretary General, or Physician General of the Commonwealth, Dr. Rachel Levine, actually had a call with all members of our delegation and members of the Pennsylvania General Assembly to go over what the Wolf administration is doing. So there's been a lot of activity as far as what I've seen, trying to make sure people are informed. I know we talk about social distancing, so maybe I can just cover that because I know one of my colleagues had a question about that too. You mentioned social distancing, but what does that mean for, I know we talked about a lot of sporting events and schools, but are there any other private events where people might want to think about social distancing, and what might those places be?
I'll have Tony add, but we're giving out guidance in terms of the size of events that should happen, you know, and really discouraging people from having large events. And now it's different in different communities by the kinetics of the outbreak right now. And we're looking at each community to develop it. That's why we put our matrix out there. Social distancing is we want people to stay 6 feet away or more.
Okay.
So if you can have an event and keep people outside and they can stand 10 feet away from each other, you know, that's how we refer to social distancing. But you see, we really are in a mode that this is time for big events like March Madness, big events like these big sports arena things to take a pause for the next 4 to 6 to 8 weeks while we see what happens with this outbreak in this nation.
Okay, thank you. And again, I'm going to reference back what the Physician General had said so far, because I know there's been a lot of questions about testing. And Dr. Levine said, so far in Pennsylvania, in every case where a doctor deemed a COVID-19 test to be medically necessary, that test was performed. So that's according to Dr. Rachel Levine. She later went on to say that the state has the capacity to do the number of tests per day that they need to, or that they can do their capacity. And mentioned actually LabCorp and Quest Diagnostics are now able to provide the tests in Pennsylvania. And these companies will report any positive results to the state, and they will be made public. So it appears like Pennsylvania, you know, the fifth largest state by population in the nation, and the world's 18th largest economy has sort of figured this out. Because she goes on to say, we will meet the demand for testing, and we're following the guidelines to do that. So Pennsylvania is able to do that. What things might have happened in Pennsylvania that we could put in place in other parts of the country if they're having trouble with testing?
Thank you, Congressman. I think the big issue is just effective communication, because, you know, Quest and LabCorp is really in all of the states in the country moving forward. We've gotten, all the public health labs have gotten the resources from CDC. I was told by the head of the American Public Health Labs in the last 24 hours that he's gone through all the public health labs, and not a single lab lacks the kit, the reagents, the capacity to do testing right now. So I do think a lot of it is just effective communication.
Well, it seems like Dr. Levine and the people in the Pennsylvania Department of Health seem to be headed in the right path, so I'm glad for that, and I'm just hopeful that we can replicate that.
I would just like to add my congratulations to them. I mean, I know Rachel well. They're a very serious health department, and they've stepped up.
Thank you. Dr. Fauci, what can we do as Congress to continue to work with the Trump administration and state health agencies to ensure that the public health experts and private sector healthcare providers have what they need to continue to respond to COVID-19?
I believe you've already done that to a big extent by the supplement that you've done, the $8.3 billion supplement, which really allowed us to do the kinds of things. Each of us are responsible for different aspects of the response. I know, speaking for myself and my agency, the NIH, the amount that we got from that supplement, that we will get from that supplement, will allow us to really accelerate what we've done in the arena of therapy, as well as the development and acceleration of vaccines. So I want to thank you for that. That's probably the most important thing. The other thing I think is important is what you're doing right now, to have the opportunity to come before you within reasonable, you don't want to come every day, but to come enough to be able to really get the American public to really hear from us, because this is an evolving situation. It's not static. It's not one-off and you're done. It's going to just evolve over the next several weeks.
I just want to add one point. It's been so important. CDC just announced that we're going to award over $560 million to the front lines of this response. That's the local, state, and territory health departments.
Thank you.